I'm going to talk about the holistic examination of the therapeutic boundary. But before I start about it, I'm going to read you a poem. There is going to be a poem at the beginning, which is now, and there's going to be another poem at the end. The vessel, the space between us, thin as breath, a sacred map, drawn firm and sure, not walls of stone, but threads of life, to hold the dark, the light, the pure. The self dissolves, the soul takes flight. Within this bound and hallowed frame, where healers' craft and pure hearts on sight must guard the undefended frame. So let's start. A holistic examination of therapeutic boundary. The initial premise remains correct. The boundary between a holistic psychiatrist and a patient or participant is not merely a set of rules, but a dynamic living entity essential for the sanctity and efficacy of the entire therapeutic process. Its timing is not in itself a sign of professional failure, but rather an inherent occupational hazard of the work, demanded profound and constant ethical, moral, and professional engagement from the clinician. Within the relational framework, it is crucial to emphasize that holistic psychiatric formulation is distinct from judgment or criticism. It constitutes a holistic diagnostic reality, an empathic, compassionate, integrative understanding of the individual with the full context of their biological, psychological, social, cultural, and spiritual existence. This approach seeks not to label, but to comprehend the unique narrative and phenomenological experience of the person, forming the essential foundation for any collaborative treatment pathway. The holistic foundation of entheogenic psychotherapy, the interconnected framework. Holistic psychiatrists practicing entheogenic psychotherapy must appreciate the interconnectedness of mind, energy, body, and spirit, the necessity of comprehensive and individualized approach, and the unique ethical, moral, and practical considerations inherent in working with non-ordinary states of consciousness. The multidimensional impact of entheogens. A key area of practitioner awareness is the understanding that entheogens affect people on all these levels. The induced experience can elicit distinct physical and energetic sensations, intense mental and emotional states, and a profound spiritual or existential insights. For genuine healing and potential resolution or cure to occur, all these dimensions must be skillfully addressed within the therapeutic container. The scientific and psychological underpinnings, the neurobiology of attachment, transference, and countertransference. The therapeutic relationship consciously utilizes the mind-brain's innate attachment systems. The holistic psychiatrist provides a secure base, a source of safety, achievement, and non-judgmental, non-critical listening. This activates neural pathways associated with trust and vulnerability, a vital neurobiological mechanism of therapeutic change. However, this very process inevitably fuels the dynamics of transference and countertransference. If these powerful forces are not recognized, contained, and analyzed for the patient's or participants' benefit, they can lead to a significant breach in the therapeutic alliance. Transference is the subconscious and unconscious redirection of feelings, emotions, thoughts, desires, and expectations from past significant relationships, such as parental figures, onto individuals or situations in the present. Within therapy, patients or participants project these unresolved mental, emotional states onto their therapist. This process allows the therapist to understand a patient's or participants' deep-seated relational patterns by holistically analyzing how they relate to the therapeutic relationship. It reveals unresolved childhood and other conflicts and aids patients or participants in gaining insight, enabling them to mature beyond these historical influences. Countertransference refers to the therapist's own subconscious and unconscious mental emotional reactions to a patient or participant. These reactions stem from the therapist's unresolved issues and past experiences and can be mirrored or triggered by the patient's material or behavior. While unexamined, countertransference can hinder therapy by compromising clinicians' objectivity when recognized and managed effectively, often through reflective practice and supervision. It becomes a valuable diagnostic tool. It offers crucial insight into the patient's or participant's internal world and habitual relationship patterns. Power imbalance, cognitive vulnerability, and heightened suggestibility. An individual seeking assistance as a patient or participant is by definition in a position of need, which creates an inherent state of vulnerability and a consequential power differential. The holistic psychiatrist, occupying the role of the perceived expert and authority, holds significant influence over the therapeutic or participatory relationship. This dynamic carries with it a profound ethical, moral, and professional obligation to wield such influences with extreme care, deliberately orienting all actions towards strengthening the individual's autonomy and capacity for self-determination. This responsibility is further underscored by the need to acknowledge the heightened suggestibility that often accompanies states of distress, uncertainty, or intense therapeutic engagement. A practitioner must therefore remain vigilant to ensure that their guidance, however well-intentioned, does not inadvertently override the individual's own values, preferences, or critical judgment. The ethical and moral imperative is to create a collaborative space that mitigates the effects of this inherent power imbalance, using professional influence not to direct but to empower, always prioritizing the cultivation of the individual's own agency within the process. Cultural and spiritual humility and respect. Holistic psychiatry, a psychiatrist as well as a patient or participant must acknowledge the historical and traditional use of entheogens within indigenous cultures and approach these practices with cultural and spiritual sensitivity, avoiding appropriation. It is essential to respect and non-coercively incorporate the patient's own cultural and spiritual background into the therapeutic process. The frame as a container. The consistent setting, time, fee, and conduct from therapeutic frame. This frame acts as a container for intense, often chaotic mental, emotional, and spiritual states. Any rupture compromises this integrity and can be profoundly destabilizing. The philosophical, ethics, and moral dimensions. This is fundamentally a philosophical problem concerning power, responsibility, and the human encounter. A relationship of unequals for the sake of equality. This intentional asymmetry is an ethical, moral, and professional duty. The holistic psychiatrist's needs are kept secondary to create space dedicated to the patient or participant. Emmanuel's concept of the other is pertinent. The patient's or participant's vulnerability places an infinite ethical, moral, and professional demand on the psychiatrist. Virtue ethics practice beyond the rule-based logical approaches, virtue ethics is essential. The character traits of a good holistic psychiatrist: truth, honesty, integrity, courage, empathy, compassion, and practical wisdom, phronesis, allow navigation of gray areas where rigid rules offer no guide. The phenomenology of the encounter. Therapy requires disciplined subjectivity. The holistic psychiatrist must be fully present, engaging with empathy and compassion, but not succumbing to sympathy. This delicate balance is when the line is at its thinnest and most potent. The spiritual, transcendent, entheogenic considerations. The work naturally touches on spiritual themes, their dimensions intensified with entheogenic psychotherapy. The sacredness of confession and witness. The consulting room is a modern secular sanctuary. A breach of trust here is a form of sacrilege. In entheogenic psychotherapy, this sacred trust is paramount. The profoundly non-orderly states place the patient or participant in unparalleled vulnerability, where the guide's role as a grounded ethical, moral, and professional witness becomes the essential anchor. Holding the shadow. Dr. Carl's Jung concept of the shadows is highly relevant. Entheogenic experience can catalyze a rapid and intense confrontation with shadow material. The holistic psychiatrist must possess exceptional self-knowledge to hold this space without projection, which is a defense mechanism when one subconsciously or unconsciously attributes one's own unacceptable thoughts, feelings, emotions, impulses, or traits onto a patient or participants to avoid confronting them internally. It's like a person feeling insecure, accusing others of being judgmental. Ensuring the patient's or participant's journey remains central. The boundary prevents the guide's own unprocessed material from contaminating the patient's or participant's visionary states. The grounding of potentiated sexual energy. Entheogenic experience can, for some individuals, involve a powerful intensification and liberation of life energy, which may manifest as heightened sensual or sexual feelings. This potent energy must be skillfully recognized, contained, and grounded within the therapeutic frame. The holistic psychiatrist has an absolute duty to navigate this dynamic with profound professional discipline, ensuring this vulnerable expression of vitality is directed solely towards integration, self-understanding, and psychological or spiritual healing, and is never, under any circumstances, exploited or abused. Central to this duty is maintenance of strict and unambiguous professional boundaries. Physical touch within a session must never be assumed. Any potential use of touch should be discussed and explicitly consented to in advance, outside of a non-orderly state. This boundary acts as a critical safeguard, transforming raw, potent energy into constructive force for healing and potential cures, rather than the source of harm. Spiritual materialism and spiritual bypassing. A holistic psychiatry addresses spiritual materialism and bypassing by grounding the work in the patient's or participant's entire lived experience. prioritizing psychological integration and self-awareness over transcendent escapism. Addressing spiritual materialism. Spiritual materialism involves the ego co-opting spiritual experiences for self-enhancement or status. The holistic psychiatrist counters this by encouraging non-attachment, guiding participants away from spiritual achievements and towards valuing in the process of growth itself, fostering humility, modeling humility to counteract spiritual elitism and emphasize shared human imperfection, focusing on real-world engagement, prioritizing practical engagement with daily life relationships and responsibilities, normalizing struggle, framing mental emotional challenges as integral to growth, not as spiritual failures, addressing spiritual bypassing. Spiritual bypassing uses spirituality to avoid unresolved psychological issues. The holistic psychiatrist intervenes by adopting a holistic approach, ensuring spiritual work complements, not replaces, mental and emotional healing across all dimensions of the individual, emphasizing the way through, guiding patients to face painful mental emotional states and trauma directly rather than transcending them, integrating psychological modalities, using frameworks like internal family systems to address the underlying needs driving bypassing, facilitating through integration, ensuring post-experience integration is robust, grounding insights and addressing unearthed issues, modeling healthy boundaries. Clinicians must examine their own spiritual biases to avoid imposing worldviews or enabling bypassing. Assessing community context, evaluating whether the patient's participant's spiritual community supports healthy psychological work or encourages further bypass. Ultimately, the holistic psychiatrist provides a non-judgmental space for the patient's participants' full human experience, fostering genuine healing over ego-driven spiritual persona. The silver lining entheogenic psychotherapy. I'll talk about it a little bit later. The silver lining and the syntropy. Compassion without attachment. This Buddhist principle, deep compassion without needing anything in return, is the purest form of therapeutic care. Entheogenic work demands this in its uttermost expression. The boundary ensures that passion remains gently, allowing the patient's or practitioner's unique journey to unfold without the guide's attachment to a particular outcome. The quiet skill navigating non-ordinary states of consciousness. The incorporation of entheogenic psychotherapy necessitates a distinct and acquired clinical skill set that extends far beyond establishing an appropriate second setting. The holistic psychiatrist must become a proficient navigator of non-ordinary states of consciousness. This requires therapeutic poise in non-ordinary states of consciousness, the ability to remain deeply centered, mentally, emotionally, spiritually regulated, and intuitively responsive amidst the patient's participants' potentially intense catharsis, visionary content, or existential distress, without resorting to premature reassurance or interpretation. Navigational competence, a nuanced understanding of the common typologies of entheogenic experience, mystical, psychological, somatic challenge, and the skill to support the patient's or participant's process without directing it. This involves knowing when to offer a grounded presence, a gentle verbal cue, or respectful silence. Preparation, integration as core competencies. It is essential to understand that the dosing session itself is only one component of the treatment. The most critical skill for the practitioner is facilitating integration of insights from non-ordinary states of consciousness into ordinary waking life. This process involves helping the patient or participant translate ineffable, symbolic, and deeply personal material, whether mental, emotional, spiritual, into meaningful cognitive, behavioral, existential change. Ultimately, it is about weaving the transcendent experience back into the fabric of their personal narrative. To achieve this, thorough preparation is fundamental. This phase involves setting clear intentions, being attentive, managing expectations, building a strong therapeutic alliance, and teaching practical self-regulation tools or skills such as yoga, meditation, mantra, yantra, mandala, pranayama, or other breathing exercises, martial arts, and other mindful somatic and grounding techniques to support the individual during their journey into non-ordinary states of consciousness. Following the experience, dedicated integration sessions are crucial. These provide a supportive space for the patient or participants to make sense of the insights, process any challenging material that may have arisen, and consciously apply their new understandings to daily life. This integration work is what anchors the experience and fosters lasting change. Synthesis and advanced nuance and maintenance. Boundary maintenance is a proactive dynamic practice, especially within an entheogenic context. Supervision of peer consultation and interdisciplinary collaboration. The practice of entheogen psychotherapy demands an unwavering commitment to professional containment and personal development. Given the intensity of this work, robust clinical supervision or peer consultation is non-negotiable. Such a forum provides an essential container for processing profound patient-participant material and for managing the practitioner's own countertransference, as I mentioned in the beginning, thereby ensuring the patient's or participant needs remain paramount. Concurrently, the clinician must stay abreast of the latest scientific literature and evolving formal guidelines through continuous personal development. This professional diligence must be paired with deep personal reflection, undertaking one's own therapeutic work and engaging in supervision with experienced colleagues are indispensable for cultivating the self-awareness required to recognize personal biases, vulnerabilities, and one's own metaphysical orientation. Finally, holistic psychiatry should effectively, if necessary, work with a team of professionals, called therapists, spiritual health practitioners, shamans, to provide additional comprehensive care and the balanced capacity that counteracts a pure conventional biomedical approach. The management of gratitude and awe. In entheogenic therapy, gratitude can be amplified into feelings of spiritual reverence. The holistic psychiatrist must acknowledge these feelings while firmly grounding the relationship in its therapeutic purpose, redirecting the credit back to the patient's or participants' own inner healing and potentially curative intelligence. The digital frontier integration. Explicit frameworks for digital communication are critical. For entheogenic integration, where insights may arise urgently outside sessions, clear protocols are essential to maintain therapeutic frame while allowing for structural support. The gift of limitations and the expanded container. Therapeutic boundaries are not a cold wall, but the architecture of safety and freedom. In entheogenic psychotherapy, the boundary is both more rigid and more expansive. It is rigid in its ethical, moral, and professional imperatives that are unassailable safeguard against any form of abuse, yet expansive in its capacity to skillfully hold non-orderly states of consciousness and potentiated energies. It forms the steadfast set within the set and setting, providing the consistent, expertly held container that allows for a deeper transformative journey into the self. Incorporating subconscious, unconscious, superconscious traits and states. In the therapeutic setting, both the holistic psychiatrist and the patient or participant navigate not only the conscious mind, but also the subconscious and unconscious realms, along with the potential for superconscious experiences. The subconscious and unconscious dynamics. The subconscious and unconscious hold memories, feelings, emotions, and experiences that may influence behavior and thought patterns, often outside of conscious awareness. The holistic psychiatrist must remain attuned to these dynamics, facilitating a space where buried material can surface, allowing for healing, potential cues, and integration. Techniques such as mindfulness and others I mentioned, reflective listening, and somatic engagement can aid in accessing these deeper layers. Superconscious states. The superconscious, often associated with higher states of awareness or spiritual experiences, can be vital in therapeutic settings, particularly with entheogenic contexts. The holistic psychiatrist must cultivate their own superconscious awareness to effectively guide patients, participants through these elevated states. This requires a balance of intellectual humility and confidence as the holistic psychiatrist navigates the fine line between guiding and allowing the patient or participant's journey to unfold organically. Therapeutic maneuvering. Therapeutic maneuvering requires navigating these multifaceted states with an understanding of the interplay and an ability to respond holistically. The holistic psychiatrist must employ therapeutic tools and techniques that honor the complexity of the mind, energy, body, and spirit, ensuring the process remains safe, ethical, and profoundly transformative. In this work, the practitioner must also remain conscious of the inherent power dynamics within the therapeutic relationship, carefully avoiding the imposition of their own beliefs or agenda upon the patient's or participant's experience. Here, the professional boundary acts as both a protective barrier and a supportive framework, enabling deep exploration without the loss of direction. Yeah, I'll just finish this because there is a bit more, but just give me 5 minutes, please.
Yeah, sure.
The silver lining entheogenic psychotherapy. The silver lining refers to the potential for profound therapeutic gain, even from challenging experiences. This paradigm shows promise for treatment-resistant conditions by targeting root causes and enhancing neuroplasticity. Holistic psychiatry integrates this by treating the patient or participant as a whole, mind, body, energy, spirit, with emphasizing preparation, support, integration. Primary benefits: processing difficult mental and emotional states. Challenging experience can be reframed as opportunities to confront trauma and fear, leading to mental and emotional catharsis and insight. Breaking rigid patterns. Entheogens can disrupt the default mode network, breaking negative thoughts, loops in depression, addiction. Profound insights and spiritual awakening. Experiences of interconnectedness and temporal ego dissolution can provide renewed meaning and reduce that anxiety, particularly palliative care. Enhances neuroplasticity. These substances may stimulate new neural connections, supporting long-term therapeutic change, rapid and lasting effects. Studies note rapid sustained symptom reducing treatment-resistant depression and PTSD unlike conventional antidepressants. A holistic psychiatric approach, comprehensive assessment, evaluate physical health, mental, emotional well-being, social context, and spiritual beliefs by other rock support involve preparation, setting intention, educational, challenging, spirit-guided support, a safe setting with trained facilitators, integration, accessing insight for lasting change, synergy with other modalities, combined with mindfulness, all the other things I mentioned, to enhance overall well-being, addressing root cause, use insights to address core traumas, psychological patterns, not just symptom management, cultural, spiritual competence, acknowledge the law, that's what I mentioned. By embracing this modality within a whole person framework, holistic psychiatry can maximize its healing and curing potential for patient participants unresponsive to conventional treatments. Now a very little back, that is the syntropy, and then the conclusion. The syntropy. In entheogenic psychotherapy, syntropy describes the psyche's inherent tendency towards order, complexity, and meaningful coherence, acting as the complementary opposite to psychological entropy, disorder, and fragmentation. Holistic guiding principle integrating traditional psychotherapy with an understanding of non-ordinary states and the transpersonal to facilitate profound healing and potential cures. Pre-session preparation, the set is set during the entheogenic session. The holistic psychiatry adopts a supportive role, trusting the patient's or participants' internal inner healer to guide reorganization. Emphasis is placed on facilitating meaning-making, helping the patient or participants move from raw entropic material towards coherent narrative. Non-dual or unitive experience are validated as syntropic movements toward interconnectedness. Post-session integration. The core work involves integrating insights into everyday life, transforming transient syntropic experiences into lasting changes. The holistic psychiatry assists in bridging mystical experiences with personal reality, fostering greater connection and purpose. This is framed as an ongoing journey of self-transcendence and alignment with natural growth. By centering syntropy in this way, the holistic psychiatry leverages the mind's innate organizational tendency to guide patient participants towards greater integration and well-being. Conclusion. In summary, the therapeutic boundary within holistic psychiatry constitutes a complex and dynamic construct demanding continual attention, skill, and profound ethical, moral, and professional consideration. By integrating subconscious, unconscious, and superconscious dynamics into clinical practice, the holistic psychiatry cultivates a richer transformative therapeutic space. This space honors the profound intricacies of the human experience and preserves the sacred trust between practitioner and patient or participant, thereby facilitating deep healing, potential cures, and authentic personal growth. Critically, this process cannot be forced. It must unfold organically, spontaneously, and freely with a held and respectful container. Ultimately, the holistic psychiatric boundary is a multifaceted entity, a scientific necessity, an ethical imperative, a philosophical paradox, and a spiritual covenant. Its maintenance, particularly within the profound context of entheogenic psychotherapy, represents the highest expression of professional duty. This demands not only vigilance and profound self-awareness, but also a specifically acquired skill in navigating non-ordinary states of consciousness. The practitioner must be adept at grounding the potentiated energies that arise from engaging with both their own and the patient's or participants' deeper psychic realms, all within a framework of unwavering yet non-attached compassion. In closing, this boundary embodies a profound respect for the sacred vulnerability inherent in the human capacity for healing, potential cures, transcendence, and integration. And I'll finish with a second point. the keeper of the frame. And when the voyage ends and sense is meant, and ordinary light returns once more, the boundary stands a true and faithful friend, a quiet anchor on the newfound shore. The keeper of the frame, with gentle art, holds fast the line twixt darkness and the day. So ever unbound, liberated heart finds its own sacred, self-directed way. Thank you very much for listening.
So, Dr. Drew, thank you for sharing that. I was wondering if you could talk a little bit about how you work with really complex psychological cases and how you use plant medicines. How do you actually bring it together for somebody who's got schizophrenia or bipolar or personality disorders?
I mean, we had three cases of paranoid schizophrenia, and we have succeeded because we work as a team. I have two clinical psychologists work with me. They are trained by me. So, and I do also general medicine. I'm also senior consultant GP. So we were able to completely remove the paranoid schizophrenia of two patients. I have it all documented. But the third one, unfortunately, we couldn't do because her brain has been too damaged by the conventional antipsychotics. She's been on a conventional antipsychotics for a long time, polypharmacy, then the same thing, no therapy, and so it was too late to do anything. So I think it's extremely important for people to understand that I am not against conventional medicine, psychology, psychiatry, but I know that is not enough. From my clinical experience for 35 years, I know it is not enough. And this is where the entheogens go into the picture, because they create this possibility, opportunity for the participant or patient to truly do the work. And then that work, if done properly, creates the change. And when the change takes place, everything changes. One's life changes, lifestyle changes, one's mood changes. Once people start, dancing more, and they start singing more, and they do exercises, and they take care of what they eat, and they are not abusing themselves anymore. They are not anymore trying to soothe this psychological pain they're carrying for so long. Because lots of people have this, lots of people have been traumatized, and not just personally, but they've been traumatized for generations. Thus, the intergenerational and the transgenerational trauma gets into the picture. And this is revealed in the ceremonies. In the entheogenic ceremonies, one can clearly see it. Where is it coming from? And then delicately, with lots of care, empathy and compassion, one is opening that can of worms or that Pandora's box, because it's not like, if you tell everything we just fine. No. You have to just tread very carefully and always pay attention to what the patient or participant is doing. Where is he or she at? And then accordingly, you align yourself with it, and you do the work. And you never force anybody as I mentioned, into anything. It has to be transparent. It has to be pure. It has to be ethical. It has to be moral. It has to be professional. And I always say to anybody who comes to me, not just patients, participants, I say, listen, I'll do my very best for you, because in this way, it is very best for me. And then people start thinking, oh, well, you know, if he wants best for me, then I have to do best for myself. And if he does best for me, I have to do best for myself. So people wake up, you know, but other thing is when people come, or lots of people come with such a polypharmacy, my goodness, it just sometimes I don't understand why they make so many drugs, you know, together. I mean, what is in their heads? What is in their hearts? What is in their minds? And then I start reducing or tapering those medications and then supplying them with the natural medicines, either plants or mushrooms, medicinal mushrooms, medicinal plants, and then slowly tapering it off, and then doing the therapy, doing the therapeutic work. And then finally, it takes about 7 to 8 weeks before any psychiatric or medication, if possible, of course, and it is completely not just reduced, but just what would be the right word for it? Not discredited, not used anymore. And so then the plants, more plants go into the picture. Very important part is also what is known here as psychogenic vomiting. When you use the non-psychoactive plants and induce the vomiting. And that cleanses the entire system and also regulates the microbiome. I mean, ideally, with some patients or participants, I'm doing the DNA microbiome tests as well when I can, and also different metabolic work when I can. But I think that the microbiome, DNA microbiome test and metabolic screening, somebody's going to talk about it, about the metabolic screening. It's extremely important. And that could be also additionally, you know, integrated in this overall approach. And, you know, lots of people are talking about the setting. But as I mentioned earlier, the skill is the most important part. Acquiring the skill to be able to navigate the non-ordinary states of consciousness accordingly, wholesomely, appropriately. So then one comes to a point when one is in non-ordinary states of consciousness, one is not just high, but one is in a state of a rapture, and state of a rhapsody, in a state of a ecstasy for some time. And it goes down, of course. But when it comes to that state of rapture or rhapsody or ecstasy, one really not just understands or feels or intuits, but one sees the things as they are. This life we've been given is such a precious thing, and it's such a fragile thing, and it's the greatest treasure one can possibly have. That's why one needs to honor it. And one needs to have a true, honest, integral relationship with oneself. And once one has that, then it's easy to have a relation with others and everything at all. Because everything starts with oneself. And everything ends with oneself. But not from an egotistical point of view. There are 3 things, in total 6 things. The human nature, the human condition, and the human experience. And then there is a brain, there is a mind, and there is a consciousness. Mind and brain are not the same. Consciousness is not mind either. But unfortunately, because as the people say here, estamos todavía en pañales. We are still in diapers of understanding the brain and the mind and the consciousness. We are still in diapers. And that is why it is so important that entheogens done properly are opportunity or possibility that we can grow and evolve further. We can revolutionize the consciousness. And we can heal and potentially cure this planet and all the beings living within its womb, because there's so many people are suffering. And, people think, if I have this, if I have that, I'll be fine. Then they have this and they have that, and they're not fine. Then some other people say, well, I better don't have this and I don't have that. Then I'll be fine. Then they don't have this and don't they have that, and still they're not fine. Because the materialistic, reductionist point of view, which is so prevalent in science, medicine, psychology, psychiatry, it's not good enough. It is not holistic. There is no future in it, because it is a sick care. It is rooted in pathology. It is not a health care. To come to healthcare, we need to do a lot of work. We need to come together, all of us who have different skills, and integrate those skills and work together with one heart, with one brain, with one mind, with one soul and one spirit. And then the things can change. This is a teamwork. This is a community work. One person can't do anything. And that's why it is important that all of you are there, and it's important what you are doing. Lakshmi, organizing it all. It is so important, and people finally understand that this is not against the conventional, the orthodox. This is just freedom of choice. That we have the opportunity, possibility to do things differently. And we should not be criminalized for it. This is my point of view. So I do also have a triple pad prescription pad, and I do prescribe entheogens legally here in Peru because I have a permit for it. So I had people, as I'm also an international member of the American Psychiatry Association, and other things, I do, people here do come, and insurance companies, do pay. So, there is a way, but it is extremely important, to understand that this is a communal affair.
Thank you, Dr. Drew. I think we have 30 seconds left if you want to wrap up.
Thank you. Thank you. Thank you all for being there. And thank you all for doing all wonderful work you're doing. It makes me happy, gladdens my heart.
Thank you.